I think this is one of the most dramatic changes in arthroplasty that I've seen in my 35-year career. The term robotic assisted is almost misleading to most patients. And I try to explain that I think the most revolutionary part of the robotic surgery isn't the robot itself. It's the preoperative planning. It's the ability to take the knee and do a CAT scan of it, put it up on a computer, and then literally superimpose the implants onto the knee, finding the most optimal fit for each person. Clearly, this is not the robot doing the surgery. It's not done like somebody sitting in the back room with joysticks. If I don't advance the saw, it doesn't go anywhere. If I don't move the saw, it doesn't move. The surgeon has to think through things probably more than we ever did in terms of planning these procedures. Once we've done that, the robot will allow us to execute it to near perfection. But these patients seem to get better faster. They are out of the hospital faster. We seem to be seeing less blood loss. The patients are much happier at 2 months than they were with traditional surgery. There's clearly a difference in the recovery rates. It isn't available to everybody everywhere. We've been fortunate here, and Baylor Scott & White has helped us to procure these robots, and they're expensive pieces of hardware. But I think they can make such a dramatic difference in the outcomes of these patients. I believe that this will revolutionize our patient care across the country.